LGBTQI in communities in times of coronavirus, a mixed method multidisciplinary study. The presentation will be presented by Dr. Lakis.
That's me.
Yes, and I am about to share the files. Lakis, if you give me 2 seconds.
Yes, of course.
There it is.
Okay, great. Thank you, Yolanda. Thank you, Rafaela.
Okay.
Okay, thank you for this invitation to the conference. It looks like you're ahead of a quite exciting day. This is not just because of my study, because of having a look at what is coming. I'll try to keep on time, but yes, please remind me if I abuse the time. So this is a study under development. So I'm not going to be sharing any findings as yet. Hopefully we'll get invited next year to do that. But I hope the conference will benefit from hear how we got about creating this study and demonstrate how interdisciplinary teams can come up with some useful ideas to also empower London and work with the communities and so on. So the study, as you have already been told, is about understanding Lambeth's LGBTQI plus communities. So for those who don't know, LGBT stands for lesbian, gay, bisexual, transgender, queer, intersex, and allied groups, if you like, in the times of COVID-19. And it's a mixed methods multidisciplinary study initiated by Professor Louise Ryan, a sociologist, Donna Jones, social work head of the department here at London Met, Dr. Daniela Shaw, who just joined us as a research associate, myself, Lakis, with this difficult name, and we're even supported by the current LMU students, Chinar Eidogan and Anna Jakubczak. And you see we have kind of a few partners. I may be introducing them here anyway, since we're here, so you can see that our research partners that will be helping throughout this project by advising and also helping maybe with data collection, staging events are Black Thrive, Blackout, the first sign to the left, I missed them, Lambeth Council, of course, Lambeth Links, and Opening Doors London, that deals mainly with people of older age within the LGBT plus community. So how did it all start? Very recently, a new center has been launched, Global Diversities and Equalities Research Center here at London Met. This happened in 2020, just last year, a few months ago, actually in September, with my colleague now, Professor Louise Ryan, as its director. And it's claiming to be a hub for interdisciplinary and multidisciplinary scholarship, exploring all sorts of issues around migration, diasporas, nations, regions, and localities through lenses of diversity and equality. And I guess this is where we fit in terms of diversity and inequality within a particular area of London. And Louise, being so proactive already, just managed very, very quickly, I think within weeks of the center being launched, to create this big project, to bring me on board and Donna from social work, and then come up with this exciting project, and I will explain how it got developed in a bit. Then there were these existing links with Lambeth Council, who wanted to kind of update their knowledge on its quite large LGBTQI plus population who lives actually at Lambeth in London. And they also kind of needed to reach underrepresented subsections of this community, because they noted that, as I personally noted from my own academic research, that a lot of LGBT plus research focuses on gay men. So there were communities, whether it was lesbian women or bisexuals, or from different cross sections of the community, depending on ethnic background. So, for example, Black LGBT plus people that have been underrepresented, and there was not much data about their needs, especially the challenges they may be facing in this particular time of COVID. So these challenges would be explored as part of this project that Lambeth was interested in and we were interested in. And so after Louise brought us together, we applied for funding from the London Metropolitan University Transformation Fund, and we were very successful. As I think we were very conscious that we wanted to exchange knowledge. It was between academic schools, social science, social work, sociology, local government, obviously here the role of Lambeth Council, and then NGOs and charities like the organizations I have already listed who are helping us as part of the advisory group and with the data collection and so on. Then we wanted to have some impact, public good. So we wanted to inform the communities and the council about the needs of a particular community that may have quite a few challenges to face within these times. And there was this project actually at Lambeth Council over last summer where they noticed that LGBT plus communities, they were reporting a bit more levels of loneliness. And if you think that a lot of these people may not have what we see as a conventional family, then the issues they may be facing might be slightly different or experienced to a greater extent. And then we wanted to empower London as part of this of this project, engage the community. I think we're already starting to do that in terms of how we work together with local government and research partners, and hopefully after we completed the study on how to disseminate the findings and how we can use them for the community. And as you also saw from my first slide, we already managed to involve students as researchers and collaborators, which can be beneficial to our students getting engaged in I hope a high quality research project with many levels. The project's objective, I think you got a bit of an idea. So we wanted to identify the needs of Lambeth's large LGBT communities and the challenges posed by coronavirus. We wanted to focus on the needs of Black and ethnic minority members within overall the BAME communities, but I will explain how we particularly focus on Black LGBTQI plus people as part of the second part of this project. And then of course co-design solutions, try to improve the situation in terms of the particular communities within Lambeth, and how can we do that within the constant financial constraints, if you like, that are getting obviously exaggerated by the coronavirus situation. And in order to do that, as I already mentioned from the title, this is a mixed method study. So we went about to thinking about developing a survey. This survey will identify perceptions and needs of LGBTQI plus residents of Lambeth. It will do that to a great extent, asking them a lot of information about who they are, how they feel, and so on, that I will go through in the following slides. Identify any changes since the last time these communities were approached by Lambeth Council. This was a part of a project that happened in 2005, so we're talking about more than 15 years ago, and obviously do the above in the current context of COVID-19. And then a very new innovative methodology. I was introduced to it for the first time. I claim to be the one who is doing the quantitative analysis and some of qualitative analysis, but Donna Jones from social work came up with this idea to use a developing method that is called photo voice and run some workshops around this method. And this is an art-based methodology to create safe spaces for people who come from marginalized communities to express themselves and their feelings and so on. And we will be doing that due to, this is hopefully just the first stage of a very long-term project, but for now, it is only a 6-month project. So we will be doing that to start with, at least with Black people of the community, identified by the local actors, our advisory group, as especially in need of support. And at the end of the photo voice workshops, we will also conduct a focus group to get further ideas, unpack further the perceptions and feelings of our participants. And all this is happening in consultation with our research partners as members of the project advisory group. We meet regularly. Last week we presented the draft survey, and we got feedback as to what needs to be improved in terms of technology, what we would like to focus on, the length of it, as it tends to be with these studies. So the survey, especially during COVID, I guess the vast majority of questionnaires will be completed online. So we're in the stage of creating a pilot survey. Hopefully we'll go live next week. But also, as we claim we want to approach underrepresented communities, then we will try to do that when needed via telephone, and even send a questionnaire by post, self-addressed, return addressed envelope to be posted back to somebody's home, most likely under these circumstances. The questions that we include in this survey. First, demographic information. So you can imagine it includes age, ethnic group, gender, sexuality, orientation, its level of disclosure, information about religion, disability, health status, very detailed information, a lot of it borrowed by the Lambeth Sigma research that I highlight at the bottom right of this page. Then information about the people who are caring for others, their family arrangements, their living arrangements. Do they have children? Do they live with a flatmate? Do they live alone? Or are they even homeless? And are there any changes since last March when the first lockdown happened? Then information about employment and finances and any changes due to COVID. Questions about Lambeth Council, area of residency and satisfaction with the council, the area, and in particular LGBT services provided by the council. Then special concerns in relation to COVID, any challenges. We also use the scale that Lambeth had used back in 2005 about abuse at home, knowing that a lot of people have to isolate at home. A second part will kind of employ a bit more psychometric assessment. So think of Likert type scales from 1 to 5, strongly agree to strongly disagree, or feeling very low or feeling very high. And as part of this part, we will be asking about companionship and support networks and access to them. We will be using the most social support scale. We will be asking about digital or non-access or non-access. So how do they kind of communicate with others? A few measurements on well-being and mental health, satisfaction with life, loneliness measures, psychological effects of the COVID-19 pandemic. And you see some kind of the papers we're using, the scales we're using have been published, or questions have been published even in 2021. So we try to be as current as possible. And then information about the communities, the people's involvement with the local community. So if you are actually a member of the LGBT community, what you see as a community, will you get affected even more by the fact that you have to social isolate, or will it be kind of beneficial to be able to contact them through LGBTQI plus applications that we use through tablets and mobile phones and so on? And then I am trying to squeeze some information in there about sexual behavior and health. We're still in consultation, so hopefully there is going to be something about that, just because it follows a bit on my interests. So of course, it kind of is a sexual minority, but I'm sure sexual behavior has been affected due to COVID and so on. And we will have at points and definitely at the end some open-ended questions, so people can express themselves a bit more rather than just clicking boxes and typing numbers inside, which tend to be a bit more dry. So hopefully we will get some valuable quotes to share with our partners and the public. Answers we will be getting out of this, just a few examples here. As you can see with this, if we manage to get a lot of participants on this kind of long survey, we will have a lot of answers to a lot of questions. For example, are there any differences in the number of measurements of psychological well-being depending on group membership? Do any of these differences get mediated or moderated by factors such as access to social support? What is the role of internet? What can Lambeth Council do directly or indirectly via our charities, for example, to improve the lives and well-being of LGBTQI people living in the borough? And then she thinks about Okay.
One more minute.
One more minute. I'll go even faster. So one thing that I'm not an expert at, I told you about photo voice workshops. So this is what we will do with the Black community. The use of photo voice will introduce a pedagogical tool in order to capture and reflect some of the live experiences of the participants. It's a qualitative methodological approach privileges and promotes active participation and an opportunity for participants to explore and express their experiences through the medium of photography. Okay, so there will be some photographs being taken. People will be talking on the basis of that. Obviously, we are addressing the ethical issues about this, and a focus group will try to unpack the ideas. Outputs, a research report for the council, community event in Lambeth, where the report will be presented together with the photos of the voice workshop, and academic publications, conference presentations like the one I'm giving now. In case these slides go live, this is how you may be able to help by bringing participants to us when the survey goes live in a couple of weeks. So if these slides go live, this is where you can get information. This is the flyer we will be using. There is a website, and you can contact me via email. I may forward you to some of my colleagues if I'm teaching on the day, and the telephone is working, it's getting forwarded to us. So we will be able to answer any questions you may have. And I suppose we'll go for the questions at the end of the second presentation. Thank you. Sorry if I took a bit more of your time and rushing through everything.
Thank you, Lakis. You're not really, because we started a bit earlier, so but thank you very much. We do have a bit of a space. So this is your the link. You say it's going to go live next week or so.
I suspect this is the link where you can get information about the project. Within that link, we will have the survey link that is currently getting created. We will pilot it with some of our contacts next week, and we will be sending the actual link of the survey as soon as possible, starting from the 8th of March. I suspect it may be closer to the 10th, knowing how these things work. But yes, kind of beginning to middle of March.
Okay, fascinating project. I'm sure you will have a lot of questions coming during the discussion. Thank you very much.
Thank you.
Now we have a presentation by Dr. Yolanda Eraso and Stephen Hills on the non-adherence of social distancing measures during COVID-19 in North London communities.
Thank you, Rafaela. I'm not sure that my colleague Stephen Hills is with me today. I think he was having some problems in reconnecting or connecting with the internet. Stephen, I don't think he's here. I'm just checking. No, I don't think Stephen is here today. Okay, so he told me that he might have some problems with connecting. So hopefully, I'm going to start with his presentation, part of the presentation. So non-adherence to social distancing measures during COVID-19 in North London communities. Stephen Hills is from the School of Business and Law. And this is a mixed method project, which means that we have two phases of the project. The first one is a quantitative analysis, and then it was followed by qualitative interviews. So just to talk to you about the surveys and the participants. We have 681 participants from North London residents. We use a convenient sample. And we went live with our survey between the 1st of May and the 31st of May. So that's quite a long time, I shall say, taking on this survey. The measures that we were looking at for that questionnaire were social distancing behavior over 2 weeks, demographic factors, housing factors, health factors and political parties as well. As you probably have known, have heard, politics have played quite a bit of a role in the way that people have taken measures from government. So we wanted to explore that too. And then we have a range of psychological factors and social factors as well. Some of it I will be showing it in the next slide. And for all these factors, what we did was to apply logistic regression analysis. So here you have some of the results, the range of adhering to social distancing measures. As you will see, in terms of the percentages of adherent people, complete adherent to all the social distancing measures that were implemented in the first lockdown, we should say, was very low. It was only a 7.2% of people who were able to complete adhere to those social distancing rules. And that leaves us with a large proportion of the population of the sample being non-adherents. The rate was 92.8%. Now, within that large group of non-adherents, we have distinguished what was sort of intentional or unintentional non-adherence, because for intentional non-adherent people, we identified those that were leaving the house, for example, for non-permitted reasons, or people who were meeting families or friends when that was also not permitted at the time. So here you see people meeting others was a 28.8% of our sample, and people leaving the house for other reasons was 33.3%. So you start seeing those distinctions in the behaviors, I mean, where people were less adherent, if you like, or which type of measures were for them more difficult to comply with. So we found with these factors are giving us a prediction, yes, a prediction of not adherence to all rules. So the odds of not adherence to all social distancing rules increase if a participant was not identified as highly vulnerable to COVID, had lower control over others' distancing. In particular, this is about keeping the 2 meters distancing rule, had lower control over responsibility for which coming into contact with others was inevitable or unavoidable, those having responsibility to work or those caring for someone. And if the social distancing behavior were reported after the lockdown was first relaxed. So we saw an increase of non-adherence to the rules after the 13th of May, which is when the first lockdown, easy of lockdown rules came into place. So here we have some of the type of analysis we run in terms of univariate analysis or multivariate predictor analysis. I'm not going to go into sort of detail into it. I think what we have here, you have different factors. What we have is that the univariate analysis can give you a bit of an approximation, if you like, on how relevant are each of these variables on their own. But when you keep them constant, I mean, when you run the multivariate predictor analysis, you can sort of isolate the ones that are more relevant, yes, the ones that have more weight in the analysis. So not being vulnerable versus having health or not being vulnerable to health, lower control over others' distancings, lower control over responsibilities, and the factors therefore predicting intentional non-adherence, we have, this is the intentional, those that were meeting others or were going out for non-essential reasons, we found that the odds of intentional not adherence to social distancing rules increased if a participant had lower intention to socially distance, and we have obviously the data there, had lower control over others' distancing, had a doctoral degree compared to a master's or professional qualifications. That was an interesting finding, because you tend to think that, well, the literature tend to think that more educated people are, well, supposedly more understanding of risk, or more understanding or looking after themselves a bit more. But that wasn't the case, and that was a counterintuitive finding in our survey. Voted for the UK government compared to not voting for the government. Perceive higher normative pressure from neighbours. Yes, the more your neighbours were thinking that you needed to socially distance, the more people perhaps were breaking the rules. And also those who had greater support from friends. By support, we mean in particular emotional support, being in contact with friends or being helped by friends. So you may notice there are some counterintuitive findings here. The more support you have, you voted for the government, you had the doctoral degrees. I mean, those 3 or 4, I would say, areas where we thought these results were a bit at odds with what you were expecting to find in the survey. So we ran more multivariate predictor, or the type of statistical analysis in this sense, to try to identify, but this is somehow the evidence that we found, to try to identify these predictors. And before I move to the qualitative findings, I shall say that one of the reasons why we ran as well a mixed methods is because we wanted to find out what people thought, trying to explain what's happening with the results we are gaining. Obviously, a prediction of factors is working in a way that is trying to predict precisely which of these variables is more relevant, but the qualitative analysis can somehow go in a regressive fashion. I mean, going backwards to people's thinking and trying to express the reasons why they behave in the way they behave. So here we are combining the two sort of set of data in our analysis. So as I said, we ran interview with participants. Our research design is a mixed method sequential explanatory design. That means that we started with the quantitative, but all the results of the quantitative data will inform, or have informed, because we've done it already, the interview guide, the questionnaire that we use to interview a subsample of our participants. So the idea was to explore people's accounts of intentional and unintentional non-adherence to the rules in this subsample of North London residents. And we interviewed 30 participants. And we used for that Zoom, Skype, and we did, I think that the timing of this is important, because we did the interviews between the 5th of August and the 21st of September. And if you remember, the survey took place in May, and the interviews took place at a time whereby a lot of changes in the measures that I'm not going to go in detail here, but it's just to remind you of the changes of measures during relaxation. And this is when things starts to become a bit more complicated in all of us, I suppose, to stick to the rules and to understand so many at some point contradictory rules and so many changes. So we move from stay alert, control the virus, save lives. I mean, those a new slogan from the government. Well, you might remember reopening of pubs and so on, and coming back to work. And the 9th of September, we have the new slogan, hands, face, space, and the rule of 6. So I think one issue, as we did it with the survey, was to try to differentiate intentional from unintentional non-adherence, because I think they are very different behaviors. Non-adherent behaviors, where if they are intentional, are the result of conscious or a deliberate decision making, whereas unintentional includes a lack of controllability or capability, lack of understanding about the guidance, for example. So understanding these different types of non-adherence, the associated predictors alongside people's perception will be useful for us in tailoring interventions to improve adherence. So we need to know at which level we are, in other words, at which level we are targeting really. So that's a bit of information on our participants. We try to sample for the interviews a more representative number of individuals for each group than we actually manage in the survey. So we have more or less equal numbers of females and males. We have 2 non-binary people as well. In terms of ethnicity, we also try to have more representative of BMA communities, as opposed to the data that you see at the bottom that we had in our sample, and the majority were women and white people, if, in comparison to the participants we tried to sample for the interview. And the 6 boroughs that we are talking about when we say North London boroughs is Enfield, Islington, Camden, Haringey, Hackney and Barnet. Okay, so these are the results of the qualitative analysis. Regarding our approach for behavioral science, if we use the socio-ecological model, and which includes, of course, individual level, interpersonal level, and community level. So in the individual level, we also use, which is more the psychosocial factors, we use the theory of planned behavior to help us explain some of these individual level behaviors. So the individual level factors are related to intrapersonal or psychological constructs, such as perceived ability and controllability to perform the behaviors, as well as attitudes and decision processes towards the rules. So for example, the challenges of staying at home includes emotions and personality traits like feeling anxious or lonely, reclusive, being an extrovert, for example. We found that led, in that case, many men of all ages to leave home for non-essential reasons. The inability to keep physical distance was expressed by many as frustrating, in particular people's lack of space awareness when shopping or walking in narrow pavements. Inevitability of catching COVID was another factor, but that is interesting because making people feeling that there is no need for protection as one will catch the virus anyway. And one important finding here, sorry, I'm going to some of these factors, I cannot cover all for a matter of time, is that informants expressed that their knowledge about the rules changed considerably after the first ease of the lockdown measures, and confusion about the guidelines led to a negative attitude towards rules, especially during that relaxation period. They consider the rules as contradictory and inconsistent. And at the same time, this coupled with the distrust in government's handling of the pandemic, which in our sample, like in other surveys, was very high. And this resulted in an individual decision-making, often described by participants as following common sense or doing what is sensible to do, which led many to intentionally break the rules. So here you have a gradient that put between unintentional to intentional behaviors in our findings, because as I mentioned earlier, we are trying to distinguish. I think we believe there's a need to distinguish these two different levels. Interpersonal levels are factors associated with individuals' perceptions of interactions with family, friends, and neighbors. We found another thing interesting was that many younger groups who were volunteering were at the same time admitting to breaking the rules in terms of going out for non-essential reasons. Many of them having COVID symptoms, and were at the same time feeling responsible for the community and wanted to help. In fact, supporting individuals who were shielding many of them. So this was an interesting finding in terms of how these pro-social values in a pandemic need to be informed by more protective messages and emphasize more on the risk of spreading the virus to the most vulnerable. Then we have neighbors and friends as well. We have there some behaviors. We found behaviors of people complaining about neighbors not following the rules, which leave them at the same time pondering about their own compliance. So the community level captures interactions with local area environments and services, as well as perceptions about the local area. And here there's a range of issues in relation to the environment that had a direct relationship with respondent ability to comply with the rules. These include a lack of enforcement of 2 meters distancing and mask wearing by local shops owners and supermarkets. We also have people complaining about the local parks, where mentioned have been too busy, with groups of people not being dispersed or controlled by the police. And then we have also statutory services that it was very limited at the time, the help provided for those who needed it, and leaving them, those people who needed these services, unable sometimes or at certain points to fully adhere to the norms. One example is a lady who had mental health issue who was discharged from hospital without any support, and left her not accepting the social distancing rules for 3 weeks. She said it took me three weeks to understand that I needed to be compliant. Okay, so I'm not sure how I am with the time, Rafaela, but I suppose I need to be wrapping up now.
Yeah, that's what I was going to say. Please wrap it up.
Okay. So I have some I had some text here from people that I suppose I don't want to exceed some quotations from people. But so what's next for us? Well, is the integration now of our quantitative and qualitative data into the discussion section in our forthcoming papers on mixed methods. And this is the most, I will say, more challenging point to bring the data from the survey and the qualitative results together. And we are working right now, we're working at that point. Okay, so we have some research outputs. If you're interested in follow our work, we have first we issue a COVID report that we circulated with our partners, which I haven't mentioned yet, but we engage with Public Health Islington and Camden, and Health Watch, and the North London clinical commissioning groups from the NHS. And so we issue that first report. Then we have published the quantitative results in BMC in Public Health, and we run a workshop as well with our partners, as I said, and where we discuss some of our findings and trying to find interventions to move forward. And we're grateful, obviously, to the Transformation Fund as well here at London Met that has supported this research. And I think I will leave it there. Thank you.
Thank you, Yolanda. We now have a time designated for questions and discussion. Is there anybody that would like to ask any questions? You can either put your hand up and your mic on or type it in the chat box.
Graham. Yes.
Graham, would you like to ask a question? We can't hear you. Are you able to put your mic on?
Participants don't have mic and camera, so we'll need to change the change him to a moderator to allow him to speak.
Well done, Kelly. Thank you. I hope you can hear me now.
Yes,
Yeah.
we can.
Okay, yeah, thank you for that, Kelly. Oh, thank you both to Lakis and Yolanda for some very interesting research in terms of how that's developing for you both. One of my questions was for Lakis around the use of the research tool PhotoVoice, because I think that's a really interesting tool to use. But I just wondered, given that it involves participants using cameras to kind of share their story, what their experience had been of using that particular tool, and whether it had perhaps potentially could put some people off from participating, particularly those from underrepresented groups.
Hello, thank you for the question. Yes, Graham, right? I am not yet really involved with PhotoVoice, but I can see the challenges we are already having in terms of ethics. So we haven't yet applied for ethics for that particular aspect of it, and I think it will probably be a first trying to do it online, or at least for my team. I think because participation in PhotoVoice is going to be limited to very, very few people. These are going to be participants who have read a lot of information about how it is going to work. And I don't think it's going to be a very representative sample. And this is not the scope of it, to have a representative sample of the community. So even if it goes offline and you are agreeing to either take a photo of you or being photographed by a professional and then talk about your experience, it may be the case that your face may be showing. So I suspect these are going to be people who are already quite comfortable with the idea of engaging in such a task. Now, the extra complications are going to come from doing that online if we end up having to do it online, as it's going to be even for the focus groups. Based on my own research, whenever I've done even interviews online, and there is some evidence in psychology research that the online methodology allows people to disclose even more information than they would normally do. I don't know if that is going to be the case when you have photographs. And then the photograph may not be, as I understand, I may be wrong, it may not be of yourself. It may be some kind of experience in your daily life that you want to share. So if that is the case, it may be the case that online people find themselves being able to express and disclose more information even better than they would have done face-to-face when you're faced with a researcher and in greater contact. So please watch this space. I will have, I think, much more to report once the project has taken place and we know how this is working, whether it ends up being offline or online. So I'm sorry, I'm not giving you a very informative answer, and definitely not a very definite answer, but we are with you in a way. So we're trying to think of all eventualities, and we do take advice from our group. So the reason we have these research partners is because they will be quite involved in the PhotoVoice project, so people will feel as part of already in the community. So if Black Flag, Blackout, people are there, is something that they will be running with us, if you like.
thank you, Lakis. That's really interesting. I mean, I think it's a really interesting tool to use. I guess within the LGBTQI community, there are those individuals who may find it difficult to be visible. They may want to be visible, but may find that difficult. So I think it's going to be interesting for you all as a team of researchers to see what that kind of response is. And as Amos pointed out in the comments, photo voice is often used with marginalized groups, i.e. children and young people who feel comfortable with using a camera. And I guess those are the individuals that your study will probably highlight. But thank you very much indeed. It's very interesting.
Thank you. Thank you for your input.
We have another question in the chat box. I'm not too sure how to pronounce the name. How can we relate this research to health and social care? What can we take away?
Is this for me or for both of us?
It's not specified. Mariam, would you be able to specify it?
In the meantime, I can say, obviously, health. You know, if you think about mental health issues and all these issues that people are going through during COVID, whether it's isolation, loneliness, depression, anxiety, you name it. So mental health is obviously a very important aspect of this type of projects. And then in terms of social care, for us that we are collecting this type of data together with Lambeth Council and our partners, it may be the case that we know what kind of needs residents of the particular sub-communities have within Lambeth, which then Lambeth can step up, if you like, and engage in providing social care to a different level or to a greater level, knowing all the constraints and so on. So from our project, I think this is something I could say about it.
Yes, I can chip in. I mean, I agree with what Lakis is obviously saying in terms of getting to know a bit about the needs in the case of and their experiences of different communities. In his case and in our case, we're trying to, as you probably know, these are non-pharmacological type of intervention in our research, the social distancing measures. And they have been with us for quite some time. So on a level, we try to inform, policymakers of what are people finding difficult or how they are being able to comply with these rules, and we're trying to find out why they cannot do it. And trying to understand a bit of the limitations. I think there is a lot to be done in terms of the environment. It's not only the individual behavior. This is why we use the socio-ecological model to understand people's behavior in that sense. And I think we are moving in that sense to try to understand why people behave in the way they do. And also with the hope that it's a bit more of preparedness for future pandemics that they might happen. We have very little preparedness here in the UK in terms of analysis. When we started our research back in April last year, we were at the peak of the pandemic, and we started obviously to design our questionnaire. We needed to go very quickly to do what is called a rapid review of the literature to inform our questionnaire. And it was only 3 articles in England about the swine flu. So we did know, or we very early on, we realized that it was very little written, and we needed to draw on other countries, in particular in Southeastern, in Asian countries who have much more, and it has demonstrated, I can see also from how they manage the pandemic, a much better preparedness for this. So in any case, well, yes, to wrap up, we're trying to find out about people's needs, people's behavior, and environmental aspects as well that can affect their daily lives and how they comply with rules and the pandemic. So I think, I don't know, Lakis, you have your hands up, or?
This is for another question I had about the project, so I don't have anything to add on that. Thank you. So can I go ahead with asking a question? I think I'm hijacking the session here.
Sure, carry on.
Thank you. Yolanda, really interesting findings. One clarification, and this may follow a question. When you asked people whether they voted for a government, do you mean whether they participated in the election or voted for the particular conservative government?
They voted for the Conservative. Yes, we asked a question about who they voted in the last election.
Okay, great.
Who they voted for. Yeah.
That's interesting for me, because then you get the people who voted for this particular government to, if I understood well, not to adhere as much to social distancing. Yes. And then you have the qualitative data where you get more anger, if you like, from your interviewees about this government and the inconsistency. And even though the government is consistent, its followers or its fans, you know, like this kind of inconsistency, it seems. Those who are following the rules, they're more likely to social distance. They don't support the government. So it's kind of, it's very interesting.
Yes, to be honest, this is the result of using a regressive analysis, because the majority of the respondents were not from the Conservative government, and so the majority of people I managed to interview, where very few of them were Conservative voters in this sense. However, because probably the timing at which the interviews took place, which was more during relaxation, is a trend that we saw already in our survey. We saw an increase in non-adherence for different reasons, obviously, the intentional and non-intentional as well. But yeah, but I have to say, even the people I interview, there were, I think, 3 or 4 in that 30 interviews that were from the Conservative government, and they were also against complaining about, well, we measure that in terms of trust in the government handling the pandemic. And we observed that too, at least in the sample that we managed to interview.
Thank you.
I don't know if that answered the question, but yes, there's an issue there to unpack a bit more, if you like.
Thank you, Yolanda. We do have someone with a hand up, and we do have a question in the chat box, but I'm just conscious for time. We only have like 2 minutes. We have Amnita Savage. She's asking, what about people running from domestic violence? For example, women, children. This can also be an issue.
I suppose, I don't know if this is probably with adherence to rules. Yes, definitely, Aminata. We, how can I say, we didn't find instances in the sample, at least in the interviews, but yes, definitely, there has been an issue, as we all know, in particular during the first lockdown, has been really problematic, because the rules actually at that early, or the first full lockdown, didn't account sufficiently or sufficiently clear in terms of people suffering from domestic abuse and how they can find help. That was very challenging at the time. But yes, it was definitely an issue that will have an impact in people's ability to comply. I should also say that our research was trying to look at, yes, to unpack behaviors in that sense. We didn't look at the effects. I just wanted to clarify that too. We didn't look at the effect. We're trying to explain why people behave in the way they behave. In that context, yes, issues of domestic violence will have been also captured, I suppose, but the survey, not by the interviews in our case. Thank you.
I cannot hear anyone. I don't know if I was meant to say something. We will be asking something about home abuse and if people had an abusive situation at home, but this is something for me to answer probably next year.
Thank you, Lakis. I don't know, Rafaela, if anyone has their hands up, we apparently we need to make you a presenter for you to use the microphone, but please go ahead. Rafaela, you said that someone had their hands up. Sorry. We can hear you, Rafaela. Okay. So Rafaela probably.
Technology issues.
Rafaela has disappeared now. Okay. So she had problem in connections with the connections, surely. Okay, so I think I'll check on the time. Olawakemi had a question. I'm checking. Thanks, Graham. I'm checking on that question. I think we answered that question, Graham. I believe we answered a question. Olawakemi, Marion say thank you. Yes, I think we answered that question already. Okay, so I'm checking on the time. So we are right to have a break now, and we will be back at 11:20. We will be back with the next presenter on gambling. So we have the second session on mental health and health education. Thank you very much for your comments and to the participant, to Lakis, and thank you very much for your questions as well. So we go into a break and we'll be back at 11:20.
Thank you to Yolanda.
Thank you.